Hello everybody, this is the Bulldozer, and thank you for giving me your time, and thank you for watching all my videos. Here in today's video, we are going to talk about the cervical disc replacement. And I got what's called the Mobi-C. And it's actually pretty cool because they use this now instead of using the fusion method. And it just, words can't describe how much better this is. And I'm going to be showing you a bunch of information. This is going to be a lengthy video, so I don't know how else to say it. The reason why this is going to be so long, I'm putting a lot of information in this video. So sit back, get something to drink, and stay tuned because you're going to see a lot of information, including a very raw picture of the actual disc in somebody's neck, and I will give you a warning before that happens. Here you're seeing you have to go for pre-op testing and stuff like that, and this is part of that testing. And you see this card here, and I got the same card right here, and you notice they have numbers 3, 4, and 5 they're circled. I'll let you read that. But the reason why I'm showing you this card is because look at the bottom of the card. At the bottom of the card, and you're going to notice me, let me just go ahead and say this right now. I got a webcam in front of me, and I got my video and software right here, so you're going to see me constantly pointing over here, just so you know, so I know what's coming up, and so I'm talking about the correct stuff. But here at the bottom of the card, it says, no clear fluids. Actually, before I even say it, let me go back and say this. One of the things that I was worried about is the fact was my show-up time was 9 o'clock in the morning. My surgery was 11:30. I'm a heavy coffee drinker, especially this time of year. But even still, I drink coffee. I always have a cup of coffee in the morning when I wake up. And I was worried about the fact of me getting up early in the morning, because I always get up early in the morning, and not being able to have that cup of coffee. And they told me that there would be a good chance that my time might get bumped up. And that's because, somebody could be having insurance issues, or they might have to reschedule it, or something along those lines. So she was just preparing me for that. And I'm not kidding you. One day I was literally saying, please let them change the time, because if I can't have anything to drink or eat after midnight, and I have to wait until after my surgery to get a cup of coffee, one, I'm going to be cranky as hell, and two, I'm just going to be off the wall. Off the wall. Literally, as I'm thinking of this, an hour or so after I think this, I get a phone call telling me that my time, not only has it been moved up, but I've been moved from 3 to 1. I got to be at the hospital at 5 o'clock in the morning. My surgery time is at 7:30. So I'm like, awesome. That's where this comes in. I was told no eating and drinking after midnight. So okay, so if my surgery time is now 7:30, you think they would push that back if I got to be at the hospital at 5 o'clock in the morning? No. You see it there. I don't need to hold it up. You see it there on your screen. 11 o'clock at night, I have to stop eating, and I can have clear liquids like Kool-Aid and stuff like that up to 3 o'clock in the morning. Wow. You talk about a change. I was extremely happy then, because if I like my country time lemonade and stuff like that, and we drank the stuff that's a little less sugar and all that. But yeah, I was extremely happy to see that, get that phone call. Let's talk about the medication that you can't be taking before your surgery, okay? And again, this is the stuff that my doctor goes by, Your doctor could be something totally different. And while we're early into this video, I'm thinking about it. Guys out there, you'll be glad to hear that being this surgery is only an hour to hour and a half long. At least me and one other person that I've watched their video, neither one of us had to get a catheter. So I'm assuming that's probably normal practice, being that both of us was the same way. Because you're only on the operating table for an hour and a half. And you're not supposed to be drinking anything before the surgery anyway. So, and they will ask you, do you need to use the bathroom? This is your last chance before we go to the operating room. So my guess is take and go to the bathroom just to make sure you don't need to go to the bathroom, because the last thing you want to do is have an accident. Chances are you probably won't have an accident, because I have epilepsy, and that was a major concern of mine. Me having a seizure, and because my head shakes and stuff when I have a seizure. Me having a seizure when they're operating on me, especially with my neck. And when I called the doctor's office to ask that question, because that was the major thing that I was really concerned about. And what I learned was, and people might already know this, but I didn't have no knowledge of this, that when you are put under with anesthesia, and I don't know if it's the kind of anesthesia they use or if it's all anesthesia, that basically your body is paralyzed. And so being your body's paralyzed, I won't have no seizure. Who knows? You probably won't have a bowel movement either, or a bladder movement. So that very well could be. Okay, let's go ahead and talk about this medication list. The first list that I have here, as you see on your screen, is the type of non-steroid anti-inflammatory drugs. Now, there's a bunch of medications listed on here, and actually one of mine was on here. The let me find it here, meloxicam, which the brand name is Mobi-C. That was one of the medications I was taking that I had to stop taking as well. But I wanted to bring your attention to the bottom of this page, and if you notice, they even used a red pen and put a star on it, and they circled the 7 to 10 days, saying do not take these medications for 7 to 10 days prior to surgery. Do not take these medications for 1 to 6 months after a spinal fusion surgery. Resume taking these medications upon your surgeon's approval. And actually, my meloxicam, I think it was 2 weeks. I think 2 weeks, week to 2 weeks when I got the phone call that I could start taking that again. So I didn't even have to call them, they called me. Now I'm going to show you another page here. And this page is going to be the, I don't want to try to pronounce that, it's just another page, another list of medications. And this is basically, I'm guessing, different types of blood thinners, because right away I recognized warfarin on here. That was something my mother was on, God rest her soul, but she was a cancer patient. But at the top of the page it says, because of the risk of increased bleeding, all patients must discontinue the following medications at least 7 to 10 days before surgery. Patients must notify the prescribing physician for instructions on safely discontinuing these medications. So again, they're not going to just tell you that you need to stop taking these medications. They're going to give you the steps. And again, if you have any questions, you need to ask the questions. Don't take it upon yourself. You think, I think that's the answer. Don't do that. You're dealing with the surgery. You're dealing with somebody going into your neck, going into your back, doing a spine. You don't want to mess with that stuff. If you have any questions at all, no matter how small or how big they might be, ask your doctor. Ask your nurse. If your nurse don't know, they will get a hold of the doctor and they will get you the answer you are looking for. Exact the reason when I called asking about my seizures, the nurse didn't know, and the doctor got back with me just a couple hours later telling me that, you know, when they knock you out with the anesthesia, it's your body's paralyzed. That was a message that the nurse was given to call me back with, and so that really relieved a lot of the stress and the worrying on me. And I guarantee you, when I did all this pre-op testing and everything, I guarantee you, if they would have took my blood pressure after that point, it probably would have been a lot lower, because from the day I heard about having surgery, I was in tears at one point, just because the fact is, you know, messing with your spine, messing with your neck, and me having a seizure where I'm moving my head, I'm moving my neck, you know, that's serious business. And the relief to find out that, you know, that can't happen, that was a huge relief for me and for my wife and for my family as far as that goes. Okay, now we're going to get into a lot of the more technical information in regards to this video. On your screen now is the Mobi-C. As you can see, it's got two plates with that plastic piece in the middle. It's not I know it's not plastic, but I'm just not sure what the material is. But these plates work on, you know, it's basically like this, and it allows it to do this and do this. It's like, you know, basically like I'm doing right now. It's exactly how it works. And there's going to be two links in the video description below. Make sure you watch these videos. Make sure you watch these videos. I'm going to show you a couple pictures here in a second, and these pictures are taken out of the one video, and they go over everything about this Mobi-C. I call it a Mobi-C. It's Mobi-C. And the other video has the actual surgery. So if you can stand that, make sure you watch that. Here's a picture right here that I find just absolutely insane on the difference. The yellow is a fusion, and if you notice how the person is moving their head back and forward, look at the difference. The yellow is being fused, and the green is giving the person the extra movement. Okay? Here's another picture. Now take a look at this picture here, and there we go. This picture here, it shows a person, they're basically doing this here. Okay? And you see I'm doing this, and I have no pain at all. You know, and it's remarkable. Okay? After 1 month, folks, 1 month. I'm recording this video actually a month and 4 days. I'm recording this video a month and 4 days from the time I had surgery. Now, one thing I want to point out, I need to extend this clip just 1 second here, because I need to point something out to you. Okay, something I want to point out, look at the right hand side of your screen. And you'll notice this if you watch that video. You see those two red pieces? Those are the disc. Okay? So this is causing stress on these two discs here by moving like this. Now, is it fine? Yeah. Okay? But when you have a surgery like this, it's going to limit on how you can move. But look on the left hand side of your screen. They're actually having two of these Mobi-Cs in this spine, and you don't see any of that. In fact, it actually looks like that the disc on the right is actually inflamed. I mean, look how much red's at the top and look how much red's at the bottom. Then you look at the disc over on the left hand picture, and there's no inflammation, if I can say that correctly, there whatsoever. And I think one of these two pictures talked about had something to do with the disc. I think you'll have to might have to go back and read it. Like here it says the fusion has the potential for reduced cervical range of motion. I think on the other picture it might have said something. Peyton Manning actually ended up having 3 neck surgeries, including the one fusion like I had. I actually had the same thing done that Peyton Manning and Pac-Man Jones from the Cincinnati Bengals had done, and they both went back to play in the NFL. Okay? So it's a common procedure, but they had fusion. Well, I can say Peyton Manning had a fusion done. I haven't been able to find exactly what Pac-Man Jones had done to his neck, if he had a fusion or if he had a Mobi-C. I'm thinking he had a fusion also, being that I seen the same picture of him wearing that horse collar. And he said, I'm calling it a horse collar. I think that's what it's called. Now, when you go into the OR, your family is going to be given this card. Now, every place is different. Like you see, there's a number on this card for myself. I've seen some hospitals where instead of having a person's name on that screen on a wall, they will have this number instead, and then they will have one of these codes next to it. In our situation, the hospital gave my wife a pager. And then the pager would go off, and it would have one of those codes on it, so she would know exactly on what stage of the operation I was in. She was always kept up to date, which I can really say that's pretty cool. And the Boogie 2988 just had a big surgery done also, and his wife had something similar to the same card that she showed on her Twitter page. Okay, so now I am in my room, and I'm getting all the stuff done and everything, and the doctor comes in and he puts this mark on my neck. And that's basically so I guess everybody in the OR knows exactly where they are working at. There's one thing I want to add real quick. That is a video that I saw while I was researching this operation. I will find it again, and I will add that link to the description. There is a video on YouTube that goes over everybody that's in the OR. Now, this has nothing to do with the Mobi-C, okay? But it's another spinal operation, just like what I had done. But what I find astonishing is the fact that the company that makes this Mobi-C, they have a representative standing in that ER waiting to answer any question a doctor may have. And that's just crazy. That's absolutely crazy. The fact that they could just have, 1 through 10 of these. They can just have them ready to put in. But no, the extra amount, and that's common practice. It's not just something my hospital did. Because I asked the doctor that, and he said yes, that's exactly how it is. Because I think there's like 10 people total in the operating room, and everybody has a job. And like I said, and there's one point where everybody takes a time out, and there's like, I guess it's like the head nurse or whatever she's called. She goes through and they have a checkoff list. And before anything gets started, they have a checkoff list. The way you notice these people is if you ever go to a hospital and you see somebody wearing a red hat, like you saw my popcorn hat, or actually you haven't seen it, you'll see it here in a minute. You see my popcorn hat? These people wear red hats. They are not allowed to touch the patient whatsoever. They are never allowed to put their hands on a patient. What this person will do is he will stand up against the wall, and you'll see this in the video. He will stand up against the wall, and he has a laser. He doesn't touch anything. He doesn't touch a piece of cloth. He doesn't touch nothing. He stands up against the wall, and he has a laser in his hand. And he is pointing to the tools that's on the table. And he's working one-on-one with one of the OR staff. And that's as close as he comes to touching anything. And if the OR doctor that's there has any questions, he's there to answer those questions. Again, that will be the third video link in the description that that made me feel a lot more comfortable, and I think a lot of people need to watch that video. A lot of people need to watch that video. Let's go ahead and get into the me getting prepped to go into the operating room. Now, the doctor comes in, introduces himself for the first time, lets me know how everything's going as planned, that we'll be going to the OR soon, and he puts the CM on my shoulder, like right below my neck, my collarbone, I guess you would say it. And I had no clue what he was writing there, but I know exactly what that's for. It's because when they go to the operating room, they just want to make sure everybody knows that this is the side we're working on. How many times have you heard of a story of somebody going to the ER to have one thing taken out and they took out the wrong thing? I'm sure this is another way to avoid from something like that happening. Here's my popcorn hat. And I was really hoping I could keep this popcorn hat because, and you can see my braid. My wife had to put my hair up in a braid because it would hang down in their way. If she didn't, they would have taped it. So I just told her, go ahead and put it up in a braid. Let's see if it's long enough where you can stick it in a braid. And sure enough, she was able to do it. But I was hoping they'd let me keep this hat. But this hat's what I'm talking about. You see, I got the silver one on. Mine's closed in. It's actually like a lid to a popcorn thing. But theirs is like the cloth kind you can see through, and theirs is red. The text. Okay, so they come and get me. They're wheeling me down the hallway. They're taking me to the operating room, and I'm seeing, again, these red hats. I'm seeing them all over the place. But I go into the room, and I got these two huge monitors up on the wall. And on these two monitors, you see this here. Now, what you're looking at here is on the left-hand side in that green circle, you can actually see this thick white line that's running up my spine. That's your nerves. If you look real close, you can see where my disc has came out the back of my spine and is pushing up against my nerves. On the right-hand side, if you see the red circle there, you see that white area? Well, that white area is supposed to be there. Well, see where the doctor has drawn an arrow in a pen, and I put a green circle there. You notice the white area is gone. That's because the disc has moved into that location. And again, this is the reason why I lost all my strength in my right arm, because that disc was pushed up against the nerve. I could not do anything at all with my right arm. So we go into this room, and I'm looking at these monitors. I'm like, what in the hell is that? And I'm listening to everything that's going on. I'm paying close attention, trying to hear every word that's being said by everybody. Even, this lady's got her hand on my throat. I'm like thinking, why the hell you got your hand on my throat? It's like I'm still awake. It's like, you guys ain't doing anything yet. Doctor ain't even in here. Then I hear the guy say, he must be the anesthesiast. I hear him say, we're not ready yet. Okay. We're not ready yet. You got your hand on my throat. So I start putting two together, and I'm thinking that she's going to press on my throat, and when she does, I'm going to get knocked out. So as soon as I hear him say, I can't remember the exact words he used. I'm looking at this monitor the whole time because all I can do is look up. That's all I can do. And he says, "Go ahead," and I'm gone. But this image right here is the last thing that I see. And this is the best picture I could get of it off the MRI disc. The doctor's picture they had on that monitor was a lot better. It was in HD and everything else. It was clear, and it made it look a whole hell of a lot more creepier. You guys see anything here? Because almost every person I've showed this to has seen it. And even the doctor got a laugh out of it when I showed him what I'm getting ready to show you. I'm looking at this image and I'm getting ready to like say something to the nurse, but by then I'm gone. I see a face of a monster. So look what I do to this picture. I stick 2 eyes and a mouth in this thing, and because that was the last image I saw before I got knocked out. It's like, of all things to be looking at before you get knocked out for surgery, you see this. It couldn't have been anything else. It had to be this image. And it actually took the doctor a second before he saw it. And then when I showed him the eyes and the mouth, and then he saw exactly what I was talking about. So surgery lasted like an hour and a half, recovery time and everything, hour and a half to 2 hours. I wake up out of surgery and I'm talking to the doctor like, you know, apparently I had a conversation about me playing pool, something I haven't done in over 20 years. Used to play competitive pool. Used to be pretty good at it. And but I had a good old conversation with this guy about it, and I don't remember one word of it. Here I am coming out of the anesthesia, and I laugh every time I look at this picture. But see, my braid it's still hanging in there. But you can see the incision right there. It's all closed up and it's got glue on it. No stitches, no staples, none of that. And it's, like I said, and the thing about it was, that's probably another reason why the fact is that the recovery time is less, is the fact that it's glued closed. You don't have the staples, you don't have the stitches, so stuff like that. Being it's glued closed, that's completely sealed, and when you have staples, when you have stitches, you still got an opening there. So that allows for possible infection and stuff like that, I would assume. And when they put that glue on it, then it totally seals that incision. Again, I'm just guessing there, but that'd be my best guess. But here's that picture a little closer. It's a little blurry, but I tried to blow it up a little bit for you. And you can see that the incision's really, there's really not a whole lot to it. I mean, again, it's blowed up, and the braid looks pretty good. I think my wife did a good job on that braid. I don't know about that gray hair there. The gray hair's got to go. But yeah, so the incision is really pretty good. It's not real big. And it healed up really fast. And especially when you see these next pictures, you'll be really surprised. Here's my x-ray showing the Mobi-C in my neck. You see the front and the side picture of it. And if you pay close attention, you can actually see the little teeth that's going into the bone. And tell you, let me see if I can get a clearer picture for you. See if I can blow this up some where it doesn't lose its quality, because being it's a black and white picture, I don't know if I can enlarge it any at all or not. Okay, here's a closer picture of the Mobi-C, the front and the side. And on the right hand side there, you can definitely see the teeth going into the bone for sure. And on the left hand side, you can see the row of teeth going down. And you also, on the left hand side, you can see the angle that this one's at also. So you can definitely tell, and just think, if this was fused, this would all be one piece right here. Now we're going to take and show you this picture. That's the graphic picture of the actual disc in the throat of somebody else. So if you don't want to see that, I'll actually put a time up on the screen where you can skip it to once I am putting this video together. So we're going to show that picture in 5, 4, 3, 2, 1. There's the picture of the disc. You can see how it fits in there real nice and snug. And because of those teeth, it's not going nowhere. And you can also see how with those those tools I was explaining to you, how easy it is to replace that. If they had to replace that white plastic area, it won't be that hard to do so at all. But again, the way this gentleman was talking in this video, that's something that's going to take place years down the line, not anything that's going to take place here in the near future. Here is my picture. This is 1 week after surgery. And you see, you can tell it's starting to heal up a little bit. Again, there's a huge difference from the 1 week to the 2 week. But I had a picture, and for whatever reason, don't know why the picture got corrupted. I don't know if it's from taking it from the cell phone to the computer or what. I have no clue why, but the picture got corrupted. But I'll take and show you that same picture blown up. Let's do it that way. Same picture blown up. Now you can see it's already starting to heal. If you look, like right there in the middle, you can see where everything is closed in there. So it's like it's got its pieces where it's already starting to close in. And this is 1 week after surgery. Like I said, I really cannot complain about this at all. And we move on to the next picture. And this picture here I'm going to show you right here. This is the picture that was taken 1 month from the day of surgery. 1 month from the day of surgery, and you can see how wide that how wide that surgery is, how wide that scar is. And again, it's not really noticeable. I'm pulling my shirt down, I'm pulling my skin down, so you can see it a little easier because I'm actually doing that with one hand, taking a phone. I'm taking a phone, but I'm taking a picture with the cell phone. And here I'll take and do the same thing with that picture. I will take and blow it up. Okay, and here's that picture blown up. And you can see really there's hardly no scar there. They really did an awesome job. And the people at Mayfield Brand Spine, they are outstanding. And it's amazing how many people that I have on my friends list that has not only had a fusion and stuff like this done, but has actually gone to Mayfield. Well, that's going to do it for this video. It's a lengthy video. I will try to cut it down where I can cut it down. But I hope I answered any questions people might have. If there's anything I left out, leave me a comment in the description and I will get back to you. I get back to everybody that comments on my videos. I have been just leaving a thumbs up and leaving a comment, but the person don't always know. Midnight, be quiet. The person don't always know, because not every comment requires a reply from me. So I would just leave a thumbs up. So starting with this video here, I am going to start using the heart option, and that way the person knows that I myself read their comment, and that way they know, as I say all the time, that I take this channel to heart. And it's my gaming channel, and I have another channel that I'm working on also. But I want to make sure everybody knows that I do read every comment, and I comment on the ones that require to be commented on. And the ones that require to be deleted, I delete and block. So, but again, thank you for your time. I don't know if there's anything else I can say. Basically, I think that sums it up in a nutshell. If there is anything that I forgot to mention, I will put it in notes below the links I'm going to add to this video. Again, the 3 links I'm going to add to this video. The first link will be the link to the website, or to the video that showed those images with the green and the yellow graphs. That's a video that everybody should watch. The second link will be the link to the surgery. It's an edited surgery, but it still shows a lot of graphic stuff. But again, I'm the type of person that if I want to have surgery, I want to know what's going to happen. Because if I could be awake while it was going on, I would. That type of stuff doesn't bother me. And the third will be that video I was talking about, where they talk about who all is in the operating room and who all and what every one of their job duties are, and the gentleman with the red hat being the representative from the company dealing with the implant. So again, thank you for your time. Thank you for watching. This is the Bulldozer. Have a good one.